Hello, welcome everybody. We'll give it about 10 more seconds actually. A mass influx, possibly the other session just got out. Okay, there we go, settle back down. Let's go ahead and get started. And then if anyone comes in another 30 seconds late, they'll just miss my banter. So welcome everyone to Concurrent number 6, AI Technology during COVID-19. My name is Rachel Barker. I'm with the Provincial Health Services Authority, and I'm a member of the eHealth 2022 Abstract Review Committee. This session is going to include 2 15-minute oral presentations. If you have questions or comments for our speakers during their presentation, please type them directly into the Zoom chat. And we'll have a few minutes at the end of the presentations to just go through whatever time allows. You're also encouraged to connect with the speakers directly after the session via the virtual event platform if they weren't able to answer your question or if you would think of something for them after the fact. So to get us started, I'd like to welcome to the virtual stage our first presenters, Lucinda Theodore, Senior Manager, Business Solutions, Ontario Ministry of Health, and Elise, Chien, Manager, Strategy and Consulting at Accenture.
Thank you very much.
Good morning, thank you. So good morning and welcome. As our moderator said, my name is Lucinda Theodore and I'm a Senior Manager with the Public Health IT Solutions branch. And today it's my pleasure to talk about something that's really near and dear and exciting for Elise and I. And it's about the virtual assistant. So the background to this project is through the COVID-19 pandemic, we had to very rapidly build out a case management and contact tracing solution that could be used to support the tracking and the management of COVID-19, and ultimately phase out the various tools that was being used across the province to track COVID-19. And then eventually we have the intent that this tool will enable us to record other diseases of public health significance. So this was a very fast-paced delivery, and we worked very closely with a number of areas within the Ministry of Health, and specifically around our groups with pandemic response. We work very closely with the public health units and the Chief Medical Officer of Health, as well as Public Health Ontario as a partner, as well as Ontario Health. So those were our business and stakeholders who we liaised with and partnered with. Next slide, please. So what were the challenges that were facing Ontario's public health system during the pandemic? There were huge capacity constraints as the growing COVID-19 volumes outpaced the public health's ability to manage the backlogs. There were long handling times for case and contact calls. And so to address this, the government came up with setting a provincial target of 90% of all new cases being contacted within 24 hours, which further created even more backlogs with this target to be met. So there was limited also information and data about new cases and how contacts would be made. So it made it very difficult to prioritize and plan for follow-up. So those were the challenges. Next slide, please. So here's what was done. And I'll turn over to Elise, and she's going to walk you through what we did to address the challenges. Thank you.
Thank you so much, Lucinda. My pleasure to be here as well, speaking about this. So with the team, we co-created 5 virtual assistants to support the province in managing its response and to address those challenges. How it works essentially is that from CCM, the case and contact management solution, a text message can be scheduled or sent out. And in that text message will be a link that will open up an exchange between the client, who's a case or a contact, and the VA, which is essentially a bot. The conversation goes through a series of questions that would be important for public health to know, but at the same time, the client is offered critical information that can help them through their COVID-19 diagnosis or potential exposure. The the neat thing about the virtual assistant is the use of the mobile technology, the conversation branching, and the full integration back into CCM, which has made it incredibly powerful to support the pandemic and to support public health units in addressing their challenges. The backbone and the infrastructure supporting all of this is based on integration between Amazon Web Services, so Amazon Pinpoint for the text, and Amazon Converse platform for the actual VA, all which are integrated back into CCM, which is built on Salesforce. We started with developing the VA outreach for cases and contacts first in the fall of 2020. And the purpose of that VA is to reach out very quickly, get some initial information, and provide information crucial to citizens. We then started rolling out VA case and contact monitoring in early 2021. This type of VA allows for automated check-ins throughout the isolation period. And finally, we created a mini VA that we call a VA for close contacts collection. And that has supported greatly in expediting the contact tracing process. When we were designing the VA, we kept in mind principles that would recognize the following. First and foremost, we were in a pandemic situation. And so we needed a tool to collect just enough information that could invoke action. We also realized that it's not only public health interfacing with the solution and the tool, it would be used by the public as well. And both sides had information needs. It's very useful for the public health resources to know whether or not somebody has a symptom, whether or not they can isolate, whether or not they're in a high risk setting. But at the same time, it's very important for a close contact or a person who has recently tested positive to know what their self-isolation guidelines are depending on their own vaccination status. We also kept in mind that at the end of the day, public health is a discipline based on the exchanges between people. And so offering a user-friendly tool and a tool that brings them through an easygoing conversation is what was needed at a time of heightened stress. So there were adoption across all of the VAs, but perhaps this is the slide that demonstrates just how important the VA has been. And these slides demonstrate the impact, the positive impact of the VA case outreach. So as you can see, using the VA case outreach, the province was able to continue contact tracing throughout the pandemic, because no longer was that set of activities managed solely by a phone call, and there was an opportunity to extend with a new type of tool. The province was also able to meet the 90% time to contact metric because the VA expedited the flow to provide information very quickly. The backlog of cases were effectively handled because the VA could be sent in bulk, hundreds and hundreds at a time. And then finally, the bottlenecks in the follow-up process were reduced because sending a VA meant that the client was sufficiently primed and encouraged their recall. It provided a base of information for public health units to go on. And ultimately, it made the follow-up process much more smooth. The VA, as you can see in the chart, has been critical over, the various surges of the COVID-19 pandemic. And, you will see that in wave 5, which is the Omicron wave, it was so impactful that it was utilized about 67% of the time. That means that 67% of all new cases who could receive the VA were getting it. The response rate was also very good in the sense that throughout the pandemic, it never really went below 40%. at times the response rate was 55% or even higher. And this is an excellent response rate, seeing as though for many cases, for many clients, this was perhaps the first and perhaps only time that the public health would be reaching out because of the pandemic situation. So, we'd like to talk about some of the adoption success factors that led to this success. First and foremost, we definitely had an engaged population of citizens. Everywhere we turned, people were wanting information. They were looking for it. They were glued to their phones, their mobile devices. And we found that offering information in this way was meeting the need. There was also a strong collaboration between all of the programs, public health, the design and development team. We always had the goal to reach, which was supporting the province through this pandemic. And finally, there was a mass adoption by Ontario's provincial workforce. Initially, when they started in December 2020, they were supporting 1 or 2 health units. By the wave 3, they were supporting about 17% of the province's caseload. But then by the Omicron wave, they had approximately over 1,000 employees and were supporting about 75% of the caseload in the province. And so, from the get-go, the Ontario provincial workforce had made the decision to mass adopt the VA and incorporate it into all of their processes to ensure that the contact tracing and case management process would go smoothly. That, along with the participation of all of the health units, allowed the Ontario's VA success. We did have a few challenges along the way as well. Of course, addressing the evolving guidance for case and contact management also meant that the VA needed to change constantly, quickly, and because we definitely did not want the public to hear about the guidelines from public health, but then receive a text that said something different. Also, in each successive waves, we had to maintain and monitor the performance of the overall solution. So during the Omicron wave, for example, we watched, the daily texts per day climb from 1,000 texts per day. Then it was 2,000, then it was 5,000. And at one point during the Omicron wave, we had seen approximately 10,000 or so texts going out per day. We had to make decisions really quickly to boost the infrastructure and ensure that the technical changes could accommodate the volume coming in. The last challenge that we saw was, over time, there was a little bit of fatigue on the pandemic. And so we did see a little bit of a dip in terms of the response rate, maybe a dip in the ignored text. And so to work with that, we helped the public health units continue the conversation, talk about best practices, help them with their social media posts to indicate that Ontario's public health units would still be reaching out, and this is one of the tools that was available to them. So back to you, Lucinda.
Thank you, Elise. So virtual assistants are definitely the way of the future. And based on current usage of our virtual assistant, we recognize that virtual assistants as a tool can reduce the administrative effort and overhead on the public health system. This is on the humans who do this work. And a self-service VA also caters to different demographic groups and public health needs. And we're now able to explore and look at additional flexible entry points into the client's public health journey and interact with them from a public health perspective. And furthermore, we can look at and determine where in the future we can use virtual assistant to support public health and the public for all the other diseases of public health significance that the province is responsible for reporting on. Anything you'd like to add, Elise?
No, I think you've said it right there. There are tons of opportunity for chatbots and tools like this to support all parts of a client's public health journey and to support public health. You can just imagine with the possibilities when there's real-time data coming back in from clients themselves that can be very powerful for surveillance or to support wayfinding or to support the information needs of everyone involved. And so I certainly am looking forward to continuing this type of work and continuing conversations on how chatbots and VAs can support our health system.
Thank you so much. And over to you, Justin.
Wonderful. That was a great presentation, and welcome everyone, and good morning or good afternoon, depending on where you are. My name is Justin Wolting, and I'm a manager at the eHealth Center of Excellence. And I'm here to talk a little bit about how some of our bots are helping with COVID-19 vaccine documentation. Before getting into that, just wanted to talk a little bit about the eHealth Center of Excellence and a little bit about what we're about. And so we are a not-for-profit organization, and we were established to help clinicians and healthcare organizations really help with sustainable digital health adoption. And so outside of what we're talking about today, there are several other different digital health solutions that we support, including things like e-consult, e-referral, online appointment booking, tools, virtual care, and more. But today, what we're going to be talking about is the new division that was launched in January 2020 that we call ECE Automates. And this is a new division that focuses on the design and deployment of automated solutions or software robots. And they're acting like virtual assistants. And they're doing kind of the points that you see below, helping increase workflow efficiency, helping reduce clinician burnout, which is obviously a huge problem with the pandemic. It helps really maximize the value of the different EMRs that are out there, and really helps you maximize the use of the data with the EMR for the need for use in advanced patient care. Just briefly go over what is automation, and we may also hear the term called robotic process automation. And quite simply, the idea around automation is the use of software, or referred to as like a bot, to replicate the actions of a human with a digital system. So if a human can interact with the digital system in a way, clicking on different things, opening up menus, accessing information, downloading, a bot's able to do that as well. And there are lots of different benefits from employing these kind of bots out there. It complements clinician work that's freeing them up to actually focus on patient care. It works with existing software that's out there so that you don't have to develop these complex interfaces or things. You can kind of use the systems that already exist. Because they're software, they don't need to sleep, so they can run 24/7, 365. And really, it's all about trying to support employees, trying to kind of ease the burden off of a lot of remedial tasks and help with a lot of different clerical work. So the overall idea is really just trying to solve problems. And so what we've created are 3 different bots. And because it's fun to name bots, we've kind of given them names, and each of the names helps describe a little bit about what each bot does. And we're going to be talking today about our Bernie bot, but just very briefly, we created these 3 different bots. The first bot is called our Cody bot, which is all about coding. And really, this is all about cleaning up and standardizing patient data for chronic conditions in the problem list. And what this is able to do is you can add codes to your diagnosis list, and then you can easily manage your patients in that population with 1 or more conditions. Our Sharon bot is all about sharing information between systems that aren't normally able to talk to each other. So in this example here, we're able to share information from primary care EMRs to home and community care, or the HPG system, in the form of a coordinated care plan. And so this can be done in kind of real time, and make sure that people at different levels of care have access to the same information. And then lastly, our Bernie bots actually has several different components to it, but this bot is all about reducing clinician burnout, hence the name Bernie. And so this is various things such as looking through billings, making sure that your patients for certain chronic conditions like diabetes are coming in at regular intervals, making sure that lab testing has been done at regular intervals, and helping with some things like documentation of COVID-19 vaccines, which is what we're going to talk about now. So I won't go really heavy into detail because I actually want to show you a bit of a demo for how this works a bit later on. But this is generally the process that we're going through here. And the problem that you can see there at the very top here that we're trying to solve with this bot is that the COVID-19 vaccinations were coming into primary care EMRs through the health report manager system. However, they were coming into the main chart and weren't going into the correct immunization section. So it made it very challenging for clinicians or staff to be able to run reports to understand the different patient populations of people that might need extra shots or people that are up to date, which is a big problem. And so what this bot is focused on is being able to extract that information from these different reports that come into the chart and putting them into that correct immunization section. And so this is a bit of the flow, but I'll save a little bit of time and I'll show it to you kind of live. I think that'll be a little more meaningful anyway. Before we go into the demo, just in terms of some of the benefits, what we were able to see, the clinician experience and time savings was very, very vastly improved. So one case that we have here to demonstrate is a really very busy family health team with about 10 practices and over 12,000 patients. We ran the bot for them in totality there. And the savings there was about 87 hours of clerical work of having to take information and manually type things in. It also really enabled that proactive care, which is the really important parts. So you can run much more simple searches to really understand these patient populations for patients that haven't received their shots, ones that were overdue for second shots, or ones that were qualifying for third or even fourth doses in some cases. So nothing's better than actually seeing it live, kind of running in person here. So I have a little video here to show. And hopefully it's playing here. And so I will try to annotate over the bot actually running here to tell you what's going on. So our bots live in the cloud, so they actually use a virtual private network system to connect to a clinic. So here it is connecting here. So by the way, all the actions we're seeing right now are all done by the bot. So the bot now is able to log in directly into the EMR using its own credentials. It then runs a search for patients that have at least one COVID vaccine report in their charts, but they're not actually fully up to date. And in this case, we're going to go through 4 different examples of what that could look like. It goes pretty fast, I'll warn you. So I'll try to keep up with it. So what it does is it finds these patients and it's loading each patient up one by one. And so it's loaded up this patient, in this case, patient number 1, and there is one vaccine that needs to be added. And again, it's moving really fast, but what it's doing is it found the information from the chart at the bottom, and here it is actually typing into the window, just like an employee would or a staff member would in the clinic. And it's also putting all the extra information that comes in through these reports that can be really cumbersome to actually add by yourself. We found that many clinics were putting these in, only putting the minimum amount of information in. So this is improving some of the data quality as well. So it's done the first patient, it's moved on to the second patient. And in this case, this patient has 2 reports in the chart. And so the bot is going to actually add both of them subsequently here. So again, it's understood the information from that report coming in and typing it all out here. So that is vaccine number 1, and you'll see that it actually has added into the middle immunization section. And here it's adding shot number 2. You'll see here very quickly that there also is a messaging system that we use. So after it's done, what it can do is the bot can actually send a message directly to the clinician to say exactly what happened with this patient. So we have configurable options. We don't overwhelm clinicians, but that is possible if they want to know exactly what happened. The bot handles a bunch of different various error state scenarios as well. Sometimes there are different software limitations. In this case, there's actually been a second dose manually entered by someone at the clinic, but the first dose hasn't been done. And so there's actually a software limitation there. But the bot's able to do some workarounds because it understands that scenario and it knows how to get that first shot into the chart or into the immunization section. There it is, sending the message again. In the last scenario, it's actually going to see that everything is already up to date. And that's the case in some cases. So at that point, the bot doesn't need to do anything except say that it has completed its work, or that everything's up to date and no further actions needed. And when the bot's done its work, it's able to disconnect from the EMR, disconnect from the VPN, and it's done. So the process, it does go through patient by patient. At the same time, it does move very quickly going through them, making sure it covers each scenario. So I know that was quite fast, but hopefully that gives you a bit of a flavor on how the bot actually works kind of in practice. And if you wanted to see the demonstration again, you can actually find this video on our YouTube channel as well. So I hope I stayed in my time there. So I'd have a little bit of contact information up here as well. You can contact myself, or you can contact our Automate's general email inbox there as well if you'd like, and some information about some of our social media.
Thanks. Justin, you are right on time. Very impressive. And I know Sylvia has had her hand up for quite a while. Sylvia, did you have a question for Justin? I think we've got time for maybe one question, two, if they're very quick before we adjourn.
Mine was actually not a question. I was trying to put a reaction when he mentioned the 87 hours of admin time saved. I was trying to applaud that. It was a great demo. Thanks.
Thanks, Sylvia. Appreciate that.
Thanks, Sylvia. Did we have anyone else with a question for Justin? If you want to throw it in the Zoom chat or raise your hand. So we probably have time for about one quick one. No? Justin, do you maybe want to give us a very high overview of what your other bots are doing, what's next for them for ECE Automates? Any other fun names coming up? Like what projects are you working on?
Yeah, great question. So we're working on several different bots for the a lot of them under the burnout category and under the Bernie one. So we are looking at patients that have that are on certain medications that are overdue for some of their lab testing, which is a big deal within the pandemic as well. There's a lot that got put on the back burner there. So the bots can actually go in there, look at medications, map them to different lab tests, and then the bot can see if those lab tests have been performed or not in a certain period of time. And then based off of all that information, send a message and actually say what, what tests are overdue, and it can generate the lab requisition automatically as well. And so that's a bot that's just kind of launching very, very soon, and hopefully going to help with some of those pending pieces there. And then otherwise, we're looking at things like adding artificial intelligence to the bots to make them even smarter in some of the ways that they perform their actions.
Great, thank you. I see we have a couple questions about where to find the video in the chat.
So there is the under our, and I think Pamela has mentioned or put the link in YouTube. So yeah, under our YouTube channel, if you can search eHealth Center of Excellence in YouTube, or you can go directly to the link in the chat there, you should see the video that I had just shown there with the different little annotations in the bottom left corner that are describing what's happening in the video there. So hopefully people can access that.
Perfect. So thank you, Lucinda and Elise, for that interesting look at the use of a virtual assistant. And thank you, Justin, for the important look at how bots are supporting primary care. Everyone, please feel free to connect with the presenters directly on the conference platform if you do have any questions after this. I know we powered right through this. We don't have as much time for Q&A as we would like, but they are available and love to speak with you. And next up, I would like to invite everyone to head over to the virtual trade show to engage with our conference exhibitors. The booths are accessed to the top of your screen, so we'll see you there. Thanks for coming.